Madam President, I wanted to say a few words about the new Republican health care plan that was just announced a few hours ago. And while there are some modest changes in it, the truth of the matter is that this plan remains a disaster. It remains an embarrassment. And I think the indication that it is an embarrassment is that with legislation that would impact about 1/6 of the American economy, over $3 trillion a year, legislation, because its health care impacts virtually everybody, there has not been one public hearing on this legislation. It has all been done behind closed doors. And I honestly, no matter what your view may be on where we as a nation should go with health care, whether you like this bill or you don't like this bill, I just don't know how somebody seriously can say we don't have to hear from physicians about the impact of this legislation on their ability to treat their patients. I just don't know how you do that. Or to hear from hospitals. I come from a rural state. What will the impact of this legislation and the massive $800 billion cuts on Medicaid do to rural hospitals all over the United States? There is some belief that many rural hospitals in areas where they are desperately needed will be forced to shut down. Is that the truth? That's what I hear. But I can't tell you definitively, Madam President, because there hasn't been a hearing on that issue. So I don't know how you go forward with legislation without having administrators from rural hospitals coming before the committee. I'm on the Health, Education, Labor Committee or the Finance Committee to answer that question. The president comes from a state, and I come from a state, where we have a major opioid crisis. It is devastating the entire country. What will this bill do to our ability to prevent and treat the opioid crisis, which is decimating this country from one end of America to the other? What happens if you cut $800 billion in Medicaid? How will people get the treatment that they need today, which is inadequate? In my state, it's inadequate. I don't think there is a state in the country which today is providing the necessary treatment or prevention capabilities to deal with this opioid and heroin crisis, which is ravaging America. What impact will $800 billion cut on that? I understand there's some money going into, additional money going into opioid treatment here, but how do you do that without the framework of allowing people the access to get health care? What happens if you're thrown off the health care you had? What will the additional opioid treatment money mean? And I think not a whole lot. Madam President, in this bill, there are still hundreds of billions of dollars, several $100 billion in tax breaks to large health insurance companies, to drug companies, to medical device companies, and to tanning salons. As a nation, are we really interested in giving significant tax breaks to large insurance companies and then throwing children who have disabilities off of the Medicaid they currently receive? Is that what the American people want? I don't think they do. And I have to tell you that this legislation, Republican legislation, as you know, has been opposed by almost every major national health care organization in the country, by the American Medical Association, by the American Hospital Association, by the AARP, the largest senior group in America, the American Psychiatric Association, the American Pediatrics Association. Virtually all of the major health care groups are saying that this legislation would be a disaster for the people that they serve. I was, just last night, we had a teleconference town hall in Vermont. We had some 15,000, 16,000 people on the phone. And the calls that were coming in were very painful calls because I didn't almost even want to be honest in answering the calls. A woman calls in and she says, my son has a very serious medical illness and we spend a fortune on prescription drugs. What's going to happen if this bill passes? What was I going to tell her? that perhaps her son would die? You know, it's just not something that I feel comfortable even talking about. But the truth is, and this is not Bernie Sanders talking, this is study after study after study that says that if you do as they did in the House, throw 23 million people off of health insurance, including people who are struggling with cancer, people who are struggling with heart disease, people who are struggling with diabetes. What does common sense tell you? If you're struggling with cancer and you lose your health insurance, what do you think is going to happen to you? And what study after study has shown is that thousands of people will die. It's not that any Republican here wants to see anybody die, but that is the consequence of what happens when you throw, as the House bill did, 23 million people off of health insurance. We should not be giving tax breaks to insurance companies and then throwing disabled children or people with terrible illnesses while fighting for their lives off of health insurance. Madam President, the AARP is very strongly opposed to this legislation. And the reason is pretty clear. And that is what every person in America should understand, and I'm not sure that many do, is that Medicaid now pays for over 2/3 of all nursing home care, 2/3. Now, what happens to the seniors and persons with disabilities who have their nursing home coverage paid for by Medicaid today? What's going to happen to those people? What happens if your mom is in a nursing home? You don't have a lot of money. Your mom is in a nursing home paid for by Medicaid. What happens if Medicaid is slashed? What's going to happen to your mom? Is she going to be thrown out on the street? Is she going to end up in the basement of your house? Are you going to have to make the choice about whether you take care of her or whether you put away a few bucks to send your kids to college? And if suddenly a daughter or a son is going to have to care for a mom or a dad thrown out of a nursing home, how do they go to work to earn the money that their families need? These are legitimate questions, and it would be nice to have had a hearing or two in order to answer those questions. The bottom line is that we have legislation before us which is widely rejected by the American people. The last poll that I saw was done by USA Today, suggested that 12% of the American people supported this legislation, 12%. Virtually every major healthcare organization in America opposes this legislation. And there's nothing that I have seen today, none of the tweaks that have been put into this, that make this legislation in any way, shape, or form acceptable. Now, it is no great secret that the Affordable Care Act is far from perfect. I don't think you hear anybody here say, hey, the ACA is great, it doesn't need any changes. It does need changes. Deductibles are too high in Vermont. Premiums are too high, co-payments are too high, and the cost of prescription drugs in Vermont and all over this country is off the charts. Talked to a woman, I was in West Virginia actually, talked to a woman after I spoke, and she said she's taking care of her older brother. She said the medicine that her brother, he has seizures, the medicine that her brother was using went up by 900% over the last few years. 900%. Why? Because that's what the drug companies could get away with. And tomorrow maybe 1,000%. They could charge any price they want. Anybody in America think that makes sense? Anybody happy in America? People in Missouri happy? People in West Virginia? People in Vermont happy that we are paying by far the highest prices in the world for prescription drugs? I don't think so. And there are ideas out there about how we can significantly lower the cost of prescription drugs in this country, about how we can lower deductibles, how we can lower co-payments. Now, I happen to believe, as I've said many, many times, that while it is important that we improve the Affordable Care Act, at the end of the day, this country must do what every other major country on earth does, and that is to understand that health care is a right, not a privilege. Right now, we have 28 million people who have zero health insurance. If this bill, at least the House bill were to go through, there'd be another 23 million on top of the 28, over 50 million people without any health insurance. Does that make sense to anybody? Our job is to join the rest of the industrialized world and make sure that every man, woman, and child has health care as a right, no matter what your income is. When you get sick, you go to the doctor. When you have to go to the hospital, you don't go bankrupt. That's what a civilized democracy is about. That's what they do in Canada. That's what they do in the UK, France, Germany, Scandinavia, Holland. Every major country on earth guarantees health care to all people, and that's where I want to see our country go, and I'll be introducing legislation to make sure that that happens. And more people all over this country want to move us in that direction. But right now, our job is to make sure that millions of people do not lose their health insurance in order to give tax breaks to insurance companies. Our job is to make sure that disabled children continue to get the care that they need, that older folks are not thrown out of nursing homes. That's what we've got to do. So I would urge, in the strongest possible way, the defeat of this legislation, and then let's go forward and improve the Affordable Care Act, not destroy it. With that, I yield the floor. Thank you.